Thank you, Ms. Southwell, and a pleasant good afternoon to everyone. This afternoon, it's my task, as per usual, to share with you the HEOC, the Health Emergency Operating Center Situation Report for today, September the 9th, 2020. The COVID-19 pandemic is affecting the rights, safety, and development of our children. The pandemic so far has already caused the most aggressive decline in the global economy seen in modern times. And by extension, it's affecting our children. Based on the World Health Organization, to date, 27,486,960 persons have been confirmed with COVID-19, and the human cost or the loss of life has been significant. Almost 895,000 persons have died from this disease globally. In the United States of America, over 6 million persons have been confirmed with COVID-19, and the death toll is almost 190,000. What's happening closer home in the Caribbean region? Well, as of September the 7th, there were almost 179,000 confirmed cases, and the death toll in the region is almost at 4,000. Now, when you look at the CARICOM, or the Caribbean member states, or the CARIFA member states, there have been 27,900 persons who were confirmed or who have been confirmed with COVID-19. And I want to underscore or state that 27% of the CARICOM member states have now declared community transmission of this virus. In St. Kitts and Nevis, we have no or zero active cases. And I also want to underscore that it has been 61 days since we would have announced our last case. That would have been our 17th case. To date, 1,897 persons have been tested, and we continue to allow our nationals to return home. At present, the number of persons quarantined, 220, and these would include the students and faculty at the RUSVM, the Ross University School of Veterinary Medicine, who would have returned last week. And so in all, we have 202 persons in quarantine in St. Kitts and 18 on Nevis. To date, that is between April, the end of April, and the present, today, September the 9th, 315 nationals would have returned home to the Federation. Okay, so this week, schools have reopened. So let's talk a little bit about reopening of schools. Education is absolutely critical for the development of children and youth. It's a human right and a sine qua non for the future well-being of our society. It is critical for us to balance the risk of infection and transmission of this virus in children and the community with the harms of school closure, which is impacting our children. It's impacting their physical health, their developmental health, mental health, and learning. So it's very important that we reopen our schools. What's the public health implication of reopening our schools? Now, while the concerns around infection and infectious complications in children is relatively small, it is important to consider the potential role that children play in the transmission of this virus. Children are considered to be efficient transmitters of influenza and other respiratory tract infections, and this was one of the rationales for school closure in March. Data from multiple countries suggests that children under 10 years of age are probably less likely to transmit this virus than older children or adults. There are emerging data and information suggesting that children 10 years and older may transmit the SARS-CoV virus at rates similar to those of adults. Given the significant adverse health and social implication of school closure should be a last resort intervention going forward. So in the future, we really should employ all other possible interventions, and school closure should be our last resort. Public health measures should prioritize closure of all other non-essential congregate settings prior to school closures. The health and safety of our teachers and school staff and students remain a top priority. And so there are 10 considerations that I'm going to touch on quickly. 1, screening upon entrance into the school setting. We're going to talk a little about hand hygiene, physical distancing, the non-medical and medical face masks, cohorting, the need for environmental cleaning in the school setting, ventilation in the classroom, mitigation of risk for students at higher risk for severe disease, and the special considerations that must be made for children with medical, physical, and other behavioral problems. And we're going to talk a little bit about mental health awareness and support for all children. Health screening. So schools are open, and each school now has a screening policy. And so individuals coming into the school setting, meaning staff and students, they will be screened upon entrance into the school setting on a daily basis. I want to stress the importance of hand hygiene. Frequent and proper hand hygiene is critical in the school setting. Children should be taught how to wash their hands properly. Students and staff should perform hand hygiene upon entering and before exiting the school buildings, after using the washroom, before and after eating, and before and after playtime with shared equipment and toys. And I should also add, before and after structured class settings where you share learning tools, instruments, computers, etc. There should be regular scheduling for hand hygiene above and beyond what is usually recommended. So in other words, each school, each class should have and should emphasize regular hand hygiene. This should be scheduled within the school day. Physical distancing remains important in the class setting. The objective of physical distancing is to reduce the likelihood of contact that may lead to transmission of this virus. The World Health Organization recommends a minimum of 3.5 feet or 1 meter between desks, between students and teachers. The use of the face mask. We are currently recommending the use of masks for school students aged 11 years and above. The emergency powers regulations tell us that students between age 6 and 11 are also expected to wear face masks in the classroom while under the supervision of the teacher. Children under the age of 6 years are not required to wear face masks. I recently got a question, I think it was yesterday, asking if there is a student with asthma, if the teacher can allow breaks from utilization of the face mask. And I see no harm in so doing. So in other words, if there is a known asthmatic in the classroom, and if the child is experiencing difficulty or is a bit uncomfortable in terms of keeping on the mask for a prolonged period of time, there is no harm in the teacher allowing a break with respect to the face mask. Cohorting. The purpose of cohorting is to limit the mixing of students and staff so that if a child or teacher develops COVID-19, the number of exposures would be reduced. What this is really saying is that students should be encouraged to just intermingle and interact with classmates or students within their class cohort. And so when they go out to break and recess, they should also be encouraged to play with their other classmates. So if there is an outbreak in the school and one class is implicated, only that class will be on quarantine then, instead of having to close down the entire school. So this is a recommendation. Cohorting is now an international recommendation. It also allows for more timely case and contact follow-up. Environmental cleaning is very important. And again, each school should have a schedule whereby all the high-touch areas are cleaned and sanitized on a regular basis. There's also a recommendation whereby students should not be sharing water bottles, food implements, etc. So we should discourage sharing. Yes, we need to share. However, in the context of COVID-19, in order to protect yourself from the virus, we would advise students not to share water bottles in particular. Ventilation is also another consideration, and we encourage classrooms, or we recommend classrooms to be well ventilated, especially with natural air flowing through the classroom setting. Now, mitigation of risk for students at higher risk of severe disease. So this speaks to children with underlying chronic medical conditions like asthma, other lung conditions, and even juvenile diabetes. The majority of children and youth with underlying medical conditions should be able to safely attend school, provided that appropriate enhanced safety measures are in place. For example, children who fall under this category, they can be encouraged to wear the surgical face mask versus the fabric locally made face masks, because the surgical face mask provides a higher level of protection as opposed to the regular cloth face masks. Now, special considerations for children and youth with medical, physical, and developmental problems. Now, such children or students may have difficulty transitioning back to the school setting, having been away from the formal classroom for a number of months. And so we are recommending that the parents have a discussion with the school staff to accommodate a more individualized return to school to ensure smoother transitions. Mental health awareness and support for all students. This is very, very important. I have been reading a number of articles internationally and regionally with respect to the impact of the lockdown on students. And what we are gathering is that a number of students have been depressed, some have been experiencing anxiety, some have been withdrawn, uh, different behavioral reactions as a result of the lockdown and they are being away from their classmates. And so what we are recommending is that we want the parents, along with the teachers and educators, to be vigilant and observant of these children. And you look at their body languages and try and pick up any change or changes in the students to identify those students who may be in need of medical care or even emotional and psychological support. So parents and educators should be encouraged to engage with the associated school-based health care center where available, or encourage families to seek support for children in this context. In other words, we want teachers to pick up any sign or symptoms of mental disease in any of the children who would have been impacted by the COVID-19 and by the lockdown. On a different note, I want to highlight Caribbean Wellness Week. Caribbean Wellness Day is Saturday, September 12th. That's this coming Saturday. Now, the theme for Caribbean Wellness Day and Week is, and I quote, "Stronger Together, Health Across the Life Course." And so the week begins with a walk, a Wellness Day walk on Saturday morning, 5:30 a.m. It starts at the cenotaph and it takes you along the Bay Road to the ECCB, along the highway, back down through past the CFBC College, back down to the cenotaph. That's just a summary of the path. Thank you.